Una kusha una cabo. These are the Bɔdi Bεttεh Gentri program. We're at the Salon Organization of Greater Manchester and in the Brian County. My name is John Fuller and I'm the host. And today we deal with prostatitis. We're at Dr MZ Turay in the Brian County. We're a general practitioner in the UK and Manchester. I'm also a girl that other areas of expertise within medicine. I will let him for let him explain that to you all. Okay. Like I say no more, not only one grain day na the team, na a team of doctors them, and I'll go through the team quick. Then after that, I will hand on over to Dr. Turay. We will talk to una through the session. Then at the end, when I go see when I got other medical professionals, they will go answer any questions they will get. Okay. And like I be say earlier, that the Salon Organization of Greater Manchester, and they bring this initiative to we. We're not in also for replace on our physicians them, on our doctors them, on our health practitioners. We only there also for going to generalize advice. So any advice we'll give you are not a one person we pick on. We give general advice based on the medical knowledge where the medical people they get. So they are at the big C. If you get problem, go see your GP, go see your medical professional. Okay. If you get question for ask, we go answer them. If you feel comfortable for ask them now. But if you're not feel comfortable for ask now, I will share with you the email address where you can always email me and ask question. If that's something they will give you advice and give advice. If not, then we'll refer you back to your doctor. Okay. So in the team we get Dr. Mohammed Kamara, we're an emergency medicine consultant. We're the Agbagba for the team. So anything you do in our life, you need somebody, we go ahead. So Dr. Mohammed Naina the head, and Idina we missed today. So if you not get any questions, you go find out at some point you go chip in for giving your own expertise for try for answer on a question you want to get. Okay. The next person we'll get is Wugi, when I miss Wugi to Kamara. We in a mental health nurse and also a health visitor. Instead day in our panel today. So if you not get any question, you get a lot of experience. You don't work for years within the NHS. So if you not get any questions, you will try for answer as well. Okay. And the next person we'll get now Mr. Ibrahim Sise. We in a community, we in a social worker and also a mental health advocate. So instead dinner we missed today. If you get question, if you feel say yes, na area where he gets experience in, he will try for answer. Okay. And normally we can get Miss Fatima Kuroma, but today not there with we in your area of expertise na black people them nutrition. If normally you can talk to how we able to eat healthy, which kind of combination of food they will be able to eat, we will get the best out of them and how for prepare them and stuff like that. But not in our miss today. But if you join me later, I will make sure say I let you know. Okay. The next person we'll get na Miss Aziza Sise. We're Dr. Aziza Sise. We instead getting your own program. We're talks with Dr. Sise. Unfortunately, not there with we today, but normally can deal with we. Instead na GP and vastly experience, but unfortunately not with there with we today. But by God power, in the next couple of weeks, he will join me back. Okay. Then as you know, Dr. Turay, I'm not present to we today. I'm gonna go yeri and see boku today. Instead like I say no more. Vastly experience, but I will let family tell we other areas of expertise. Okay. The next person will get me plabamate. Who have been provoked before? Mrs. Goba. Yes, I don't change them. Besides Goba, in a mental health nurse and also a social worker. Vastly experience as well. Now we missed today. If you ask any question where you feel sick, he will add value, he will answer as well. Okay. Then we get Mrs. Fatmata Kamara, when I'm Mrs. Uncle Doc in Wεll, in order with we today. But instead now, a day part of the panel, a day part of the team. And if you join me later on, I will make sure you will know. Okay. Now a mental health nurse as one I can see. And normally you can get Miss Aminata Jallo with a clinical pharmacist. We normally will talk to we as to how we will take which kind of medication for take, how for take medication, how for look after them, and stuff. Then I can normally talk to we, but I may not be on the panel now and not see it. But if you join we, I will make sure you will know by the end of the show. Okay. And the last one on the list, me John Fuller, I'm a business IT consultant. Me role now also me not a medical professional. Okay, me role now also now just a host and a facilitator for make sure this program can do in a good way for one able enjoy. Okay. All right. Like I be saying no more, I will share with email when I SLOGM health@gmail.com. If I get any question, please feel free for send me your suggestion, feedbacks to that email there. Also, if you're interested for joining the show, whether as one of the team or maybe just want to come on as a guest, feel free for email we. And also that people that we don't show interest in the past, however, are not being get the detail, because when you join Zoom, I'm not able to get to my personal details. The only way for me to forget them, please email me, then I'll be able to contact you and see how you get, which kind of role you get able to play. Furthermore, they are the big me people, them anybody will get influence for try for let we get this show to people in our salon. We don't charge nothing. You know, we all don't learn book, we all don't gain our experiences. But these are completely free. We do them off we own back. In fact, it even costs we money as well. But we not sell them to anybody. With any radio station there or TV station in a salon, we want air them for the benefit of the people. We feel, you know, we will be very obliged for we do have just for the people and benefit. Okay, so without further ado, I will hand over now to Dr. Turay. We will take on a few session today. And I thank you very much, Dr. Turay.
Okay, so thank you, everybody. Thank Mr. Fuller for the introduction. As he said, me and Dr. Turay, one of the doctors in this panel, apart from general practice, I also do a lot of orthopedic surgery and also neurosurgery as well. So, but at least we do this program then basically for help with people then. For let people then go understand, you know, the basic things them we then go look for let them go meet the doctors them and explain and get good better healthcare basically. And so I'm not going to take much time. I will start now. Try for sharing the screen. Okay, so the topic we discuss today then called prostatitis. I will explain in detail what it means, and within we at least hopefully by the end of the session we will be able to understand within a prostatitis and also within the other conditions then we they relate to them and how we go deal with them. So first, we will get a brief overview of within a prostatitis and other things that we relate to them. We explain about the signs that we're possible to look out for, or the symptoms that we look out for sure say it get prostatitis. We will alarm them for let it go see in doctor. As Mr. Fuller said, we know they replace on a doctor here. We only do this for awareness process. And also we thinking cause them or waiting at the risks involved, we will make you get this condition. And how to treat them, we'll talk about them. And if we not treat them or we treat them or not treat them adequately, waiting at the complications they will get. So now before we go, let's start for know waiting at the prostate first. So the prostate now it's like a tennis ball where it sits under the bladder. The bladder na the part of the body where all the wet, they store, and from there it go out through a tube. In the woman them, that tube very short. In the man them, that tube very long. It come out, and so this prostate only they to man them. They sit under them. The tube they pass through them. Like when I can see now, they pass through them and they get another tube we connect to when they sperm we don't store and they connect to them for come out as well. So basically that's not the prostate. You get other things in back above, you get the bladder, they get the other parts where like the balls and the south side the balls, they stay in the close but a different. And just behind the bladder and this prostate, you get outside the pook in common, then call a rectum in medical terms. So just at this picture, we can see the bladder, they a big, then the prostate, the underarm, and at the tube, this what they talk about, say now they pass through, now they the wee or the wet, they pass for come out. And at the side, the insect get blood where they supply and nerves them all where they supply them. So this now a condition where we need for differentiate from when somebody gets prostate, different things can happen to them. Okay, one, the prostate can become very big. It can be very big in size, and it surround this tube, squeeze this tube, and stop water from come out. That then call an BPH or benign prostatic hypertrophy. Then a very common, it can happen with most black men them over the age of 50, and it makes some people, they can get blockage with them, where if person don't understand, it go feel say something they don't do, either a black magic or that thing they don't do, where people can get a blockage. So this can make somebody in life can become very uncomfortable, and it's very common among men. 1 out of 3 men can get them. The next thing that happen with the prostate is cancer. We don't talk about this in detail in past program. Cancer normally can happen in somebody after the age of 65, and mostly men them above 50, but 65 years most common. And black people again are the most common people where they get them. So we don't talk about prostate all the time now, because it's common in the community. Now, apart from that, the next way they happen now, this condition we then call prostatitis. This can happen in every age. Waiting at this means prostatitis means the gland itself become red and swell and painful. So basically, nadande and waiting the cause about we will talk about that. So now the 3 common things in the wire where can happen inside where they happen with the prostate. Okay. Now, probably go try for differentiate this with other things then. So I go and let you unmute people there, let people and tell me waiting and think about this picture now. Waiting this, how they call this? Anybody get suggestion?
Now, Bozin, sir.
Okay, good.
Bozin.
Bozin, right. So we all know about Bozin, say a very common again now we community. So I bring this
pressure at the moment. Is this the right time to be introducing radical reform?
So this Bozin is not related to the prostate. It's different. A brain can for let people and will know the difference. Say this different from the prostate. That gland, and then 3 things and they why I don't talk about 9 they happen most common. Bozin, waiting they happen about waiting they cause Bozin a different. So waiting they cause Bozin. Just a brief understanding. When picking day inside in my mind belly, the testicle, we then call balls, they form from in belly in back, the back of the picking, and it begin gradually come down. It go through the groin, and it come down na a bag, we then call the balls bag. So in that process where it go after certain age where the picking unborn, the channel where that balls they pass, it block. Now in people who then get Bozin, that channel they open. So when I can see this blue thing there means the channel open. So wait up way open, water working there from the belly, because I say that balls they come out from the belly, and the drain come, it can full up. Now the bag where they make people and they get Bozin. So as a result of that, the people and they get see say the balls they big. See. So this picture just explain them here, wherein this blue thing at the water within at the belly, there is no passage for let it come inside the balls. Here for somebody where the passage open, the water they come at the balls and flop there. So this is not just one condition, one cause of the Bozin. Now the other cause of Bozin, now like this again, then you call them Bozin again. The other cause of now this. The bowel or the gut, they open it, or it gets air na the groin where no where what we call a defective side, wherein it get an hole. That hole side that balls they come out and they lock properly, so they can get small hole there, and that weakness on that part of the gut, they make your belly they make the gut, they escape through, it can form hernia. So that hernia they now indicate like this mania, now come through from the groin, take and down to the balls bag. We call it scrotum. So now they cause make her a big. So the way that they treat them, with the way that they treat that one with the water, a different. This wire, a very common with big people man, they do manual work, they go to the gym, or they do heavy work, a common with her. But that first one will be talk about when a water, it can happen with small picking them. More common with small picking them. Okay, so now I just give that briefly for explain to people and say that boozing can happen down here, outside the balls day, ain't different from the prostate. The prostate naya ide, and the bladder day above them is sit on them. So the prostate na three main things in what pumpanam, either that BPH, where the prostate just big, or it get cancer, or it get this prostatitis. So in our prostatitis, basically prostatitis now inflammation means you get swelling, redness, pain with the prostate. Okay, and this in most cases it can happen with no cause, and in some cases it happen with infection. They are in line with them, and the people it can come up, it could happen to anybody, every age. But it did mostly with people within their 30s and 50s, or even younger men. Now they see it even more with younger people. So young people more they get prostatitis, and when it comes to cancer and things, people with higher age, above the age of 65, and BPH, people above the age of 50, then the more common and get that condition. So these young people more can get this one. So basically, what it is just they say the redness when the prostate don't become inflamed, it become red and swollen, and so it can cause blockage, just similar to what happened to BPH. So I give them differentiation and they for let people know say the symptoms them where they happen, they overlap between the BPH, between the prostate cancer, and between the prostatitis. They all cause swelling, or they all can cause blockage. But the one with the cancer will make it even more dangerous now, because them people they get them without any symptom at all. They don't even get blockage. So if you get blockage, it can be say something a good sign. But if you know they get blockage and you get other conditions, then you can go through YouTube and watch the program. We'll talk about prostate cancer in more detail. So when this happened, the prostate, they red, the pain, like, they ask for help, say, I need help here. And the person, they begin get pain, they get belly pain at the lower side of his belly, and sometimes the pain with the person they get, they around the man side, between outside the poo they come out, and outside the testicle day, the balls bag, around that area day. And sometimes it can even spread go na your back, and it can even spread go na your belly. So when people sometimes they get poo, it go poo, it become painful. And it can even, when people get constipation, it can get a result to that again. The other symptoms that people they get is when you want for pee or you want for wee, it becomes so painful, and some people they gap na net, but for go wet, because the prostate inflamed, it irritates the bladder, it go more na net for go wet, even net or day, it go wet frequently. And some people when they wet, it start for wet, then it stop, it go back, it stop. And wet not they be more frequent and free like I be happen before. This symptom can also happen with somebody who gets benign prostatic hypertrophy, when a harmless swelling of the prostate gland. And some people they get blood, now they what we they see blood they. And anybody where he gets this condition, they found out say if we don't progress, they begin get pain with muscle in the heart, in joints in the heart, and they just they feel unwell, they get fever. And it even get, you know, it sweat, they get chills, something it will feel like saying malaria, I get with something not to malaria at all. Okay. And again, as I mentioned, people in they get back pain as well associated with them. Some people in they get mama and papa business, they get problem that side with the mama and papa business. Either way, the sperm one for common, it painful, you know, and they enjoy it really, even when some people, even the man side, know they tin up. So basically, this is not the condition the way sometimes some man, a man side they tin up, not to anything we do, now infection or inflammation don't happen, and before it begin associate about time or with other thing, or it begin shame about time, it meets a doctor, you explain to your doctor can find out what's the cause and treat them. So the types of and this prostatitis, I'm sorry, I get for the use this word prostatitis throughout. I just want to let people aware, say prostatitis, now when you get swelling and redness of the prostate gland. So I get for the use them all the time. You get two types of them. You get the acute, where now when it can happen less than 3 months. If you get this prostatitis inflamed and gland, they've less than 3 months. Now they call acute. This not common, but if it happens, it can be so life-threatening because it can cause blockage quick, and it can need some time for let's then treat them immediately. The next one now, if they not treat, then they can go to chronic, that it can last for 3 months. Sometimes it can be up to 6 months, and this is not the most difficult one for treat, and the most one where they affect people in life, and this is very, very common. This type in common with the people of higher age, you know, close to their 50s or 40s, but as I say, it can happen to anybody. I emphasize here back say, this not a cancer at all. Let nobody not think say we get this na cancer you don't get, or now somebody don't do something to her or do black magic to her. Now just the prostate gland we sit under the bladder, now it don't become inflamed, now it don't get problem, now it don't swell. So it just need for see doctor, let them go to it. So the causes them, and mostly we don't know the cause. They can investigate upside down, left, right, and center, then go find a cause, especially for them they own win a chronic one. But the one the way they get cause, it can be say something na infection. And if na infection, it mostly can be due to infection where people in get through sex, to mama and papa business. They call it STI or STDs, which is why this is common among the younger people, you know, the sexually active people. Then they get this infection, you go see you a young man, you could just see your balls begin painful. And most people they can't meet doctors because they get pain in balls. You just feel some size, some lump in balls where it painful. And where they painful. Now then they make people come. Otherwise, some man they go see doctors if at all. So then because as I explained before, the tube where they come out from the bladder, it come out for past the wee, a longer in man, a difficult for the man get water infection as opposed to woman. Woman, they get water infection fast frequently than man. So if man come to a doctor, he say a check him, he know say he get water infection, they look into it deeply. They check for this sexually transmitted infection. Because the way they treat them is different from the way they treat this prostatitis. So when somebody gets problem, the key at the home is see your doctor, because if you not get the right treatment, you under-treat yourself, then you end up forget complication. We'll get for can talk about before. Okay, so the other people when they get are people who then they pass catheter. Catheter na a tube when they pass for clear blockage. Mostly because they come from inside your bladder, they introduce infection. So then people in the back can get to the prostate gland because they close to the bladder, it can get infection. And people who then get recent water infection as well, they can tendency that water infection, they can go on for affecting the prostate. So, and the acute and the chronic one, the way they differentiate them, it's mostly the fact that the chronic one, they did more than 3 months, the acute one, they did less than 3 months, and mostly the chronic one, some person, they don't get acute infection before. And most people there with the acute one, they can normally don't get infection through mama and papa business, they call them STDs. And people who then get HIV or AIDS, they're very common for get acute infection. And then man them, we then get sexual intercourse with them company man. Okay, then one in day because or you get sex through your back passage outside the pool the come. Then one in day a risk is very common for letting get prostatitis, the acute form. How then they diagnose them? We go see your doctor. The first you doctor they do now for get a thorough, we call a history. Explain the story to your doctor. You get for open to your doctor. You don't get for hide things from him. You explain to your doctor how it come, when it starts, waiting you the experience, all the pain where you get, who side you get the pain. If you explain to the doctor thoroughly, the doctor will able for know which direction if we go for treat you. So now that's the first way where the doctor they know. So I make them they ask boku question. Then after that, the doctor they examine you. And when they examine, what they do, they try for examine this prostate. And the way they examine them, now for examining through your back passage, because as I've seen through the picture before, the back passage they close to inside this prostate day. So it able for examine if you feel that prostate day, it no say it painful, then it get close say this now the prostate don't become inflamed or infected. Then the next thing what it do, it take water sample or wee sample, they send at the lab for see if infection grow there. And it will able to treat you based on what the infection come up with. And the one the way don't chronic, they don't try all kind way. You get the specialist doctor, they wouldn't call urologist. When then they look after the bladder, the prostate, and also so sometimes the nephrologist can liaise with them. Then they look after the kidney because this infection can go up to the kidneys back. So then can look into that in more detail for find out why. So how for treat them? The acute one, the most common, you can start with taking just paracetamol for the pain, or you take ibuprofen because they're not anti-inflammatory. Or some people get an naproxen because they're not anti-inflammatory. They help for reduce the inflammation, and they help for reduce the swelling. So you can take their medication in it. Okay, and then the next one now antibiotics. Then we'll give antibiotics to you, but the antibiotics when they give to the when the doctor they give you, they get for tailored to certain type of antibiotics, and the duration we they give for be up to 14 days, 2 weeks. So this not a condition we get antibiotics, we get infection, you go take antibiotics for 2-3 days, you begin feel better, you stop. No, even when you feel better, you for continue the antibiotics for up to 14 days. And in the NHS, the one we then recommend, the antibiotics we they recommend now ciprofloxacin, ofloxacin, or trimethoprim. Now the 3 one in day they recommend. And your doctor can talk to you based on your allergies and other conditions there, we'll see which one was suitable for you. If the one and they no work, the next line now levofloxacin or cotrimoxazole and called Septrin. So if any medical profession they listen everything, will not say, I mean in the NHS now then treat the medication there, then they try first and for treat the person. Except if you don't get culture and the culture show a specific organism or bug, then you can tailor your treatment based on the sensitivity. Now, when they don't give down the other advice where the doctor will give you is you drink plenty of water so that you will be for clear and your bladder, and avoid for drink fizzy drink. And if you not see any improvement after 2 days where you don't take your antibiotics, we'll advise you for let you see your doctor back. Okay, either your doctor they go revisit your symptoms them and see if indeed we see the treatment the right thing, or if we consider another cause possibly they make you get problem. Or if it says until you not take the infection antibiotics for long enough, it will consider for continue. And if the doctor suspects say na infection, STD or STI, infection through mama and papa business, the antibiotics so then they give different, not to the one and they were mentioned. And the way then they look into them is different as well. So seeing your doctor is a key thing. And again, if you don't take the antibiotics for up to 14 days, 2 weeks, you don't complete them, even if you feel better, you will get for go see your doctor, or you call your doctor, long talk if you need for extend them, or if you need for stop them, you liaise with your doctor after we complete the treatment. For the chronic one, as I said, this is very difficult for treat. You will need for take antibiotics for up to 1 month or 4 to 6 weeks, 1 month, 2 weeks for you can take antibiotics. So in a very long time, you take antibiotics. Okay, and antibiotics, they come with their own side effects, then they come with their own problem back. So the antibiotics then they affect the kidneys, and then they affect the liver. So you need for see your doctor because they take antibiotics for a long time. And you get for they take painkillers for a long time as well. And basically the aim when for treating the chronic one, now basically for let them make your day-to-day life become easier, because this can really affect some people in life. And your doctor will able to check again for see if you get if they need for take laxatives for open your bowels. If you be say your bowel no open, it give laxative thing for let you clear your bowels. And also if for people who don't get them for a long time, the doctor would tell we be they examine you and notice say the gland really big. It can give you medication, them what they call things like tamsulosin. When I need to give to people who they get BPH, they can give you down the back for at least a month or two, because it help for slack or relax the muscle for help you for let you pee easily. And most people them by 6 months, they will notice some improvement. Okay, so now if they not treat them or then treat them inadequately, people then will get complications. Okay, and the complications are with the acute one, a rare, but when it happens, it can be very serious. Okay, the first common complication are blockage, as I don't mention all along throughout. With the blockage happen immediately, yeah, you see the gland very, very red. With the blockage happen immediately, then they pass a catheter or a tube through the man passage for going to the bladder for help drain the bladder. And they ask you for the drink boku water for clear the bladder. The next one we can happen when I can make most man and go see doctor. Now, condition they call epididymocarditis. What it mean is that you get this side, the sperm they transmit from the balls for come out, so they call it the epididymis, it can become infected. And then the otitis, now the medical word for balls. So you get infection that area there. So this infection or inflammation or redness, now it can make most man then, because it's painful, that pain day, then it make most man in the camp for see doctor. And any man will come see doctor with this condition, the doctor they check again if he gets any sexually transmitted infection associated with them. And as I can say, big picture, basically the gland, the epididymis, suicide the balls, they store for pass go, the sperm they store for pass go become inflamed and red, and also the testicle become inflamed. The balls also become red and painful. Now, this different from condition like prostate and testicular cancer. Cancer where they happen with the testicle. Cancer where they happen with the testicle is not painful. So I let people are able to know the difference. And mostly cancer where they happen with the testicle, if they see lump in the testicle, any man for the feeling testicle, not only woman for feeling breast, to feel the testicle. If you notice lump there and not painful, you therefore say your doctor, maybe they can do scan for see. And if not anything else they happen. Now, if they not treat you again, they get a condition then called pyelonephritis. Pyelonephritis means infection where they go na the liver, and I'm sorry, not the liver, the kidney. So you see the kidney, the infection they come out from the bladder now, it rise up, it calm na the kidney, it can infect the kidney. So this they make people begin get back pain, serious back pain. And you know they only get back pain, you they get high fever. You they get high fever, you they shake, you they fever like saying a malaria I get. Okay, so if somebody they shake, you get fever, and they no feel say all thing a malaria or typhoid, all that condition in the back way similar to that, you get back pain. And if they not treat this are ordinary antibiotics the way they take now through your mouth or pills, no they help for solve them. Sometimes you need for get drip with antibiotics for help for solver. And even after that, then you need for do a scan for check your kidneys. If again land in no work, they think you put the gland again, it will be develop abscess. Then a serious infection we don't affect the whole gland. And then they can be so not only the pain, they develop into a condition called sepsis. Okay, when the infection is spread all over your body, and that can be a life-threatening. It can lead to somebody losing a life. And for treat this can be difficult. Okay, so the chronic prostatitis in complications them, mostly 1 out of 9 people who get acute condition can lead to chronic, but this is very challenging for treat. It can take months, sometimes years, you know. It can reduce the person's quality of life. It's difficult for them to cope because sometimes one for go do work, you just feel unwell. And because of this, on Monday, they lead into depression. So this, again, we emphasize now some of the physical health problem them, we can lead to mental health problem. We don't talk about mental health so many times here that people need to get depression because they get this chronic pain where you don't take treatment, but you need to improve, it cause depression. It cause you feel anxious about your condition. It's waiting they happen with me. And this can lead some people for go meet other person. You know, for say, oh, waiting they happen there, then they begin think, say, oh, sometimes somebody don't do you this, somebody don't do you that. You know, failing to realize that sometimes then condition they happen to the person. And they become panicking now. And sometimes they affect your family, your relationship with the family and things because your life you feel say your life not really worth living. See, so this one are the condition then we can lead you to the mental health problems as well. So what's the advice so they give to people and we get this? Drink plenty of water. Okay. Ideally, everybody take not less than 2 to 3 liters of water a day. Take a glass of water, drink them, plenty of water, especially if you're in a hot country, you know, like Salon, very hot. You get for the drink plenty of water for hydrate you. And some people then go look them water. If you wet and you see you wet, yellow in color. Sometimes no means say you get infection. It means say you know they drink plenty water. You know, they can call them concentrated urine. You know, the kidney, now they sift out all the blood, the bad things that will happen, the bad water and pull them out. Because you know get better water, it get for make sure say it keep your body for let your body get enough water. So the water when they come out, it very concentrated, they look yellow. So that no means say you get infection, but something that water you need to drink better. So drink plenty of water, helpful. And then people would then like for drink coffee, tea, cola, you know, eat cola, fizzy drink, all anything and then they irritate that, then they stimulate the bladder and make you they go wet fast. So then they advise again, if you get this condition, you maybe avoid them for a while, or you cut down on them. And because the pain where people they get in this condition, yeah, now between, you know, who side you they sit down, between you who side the poo they come out, or who side the balls area they around that side they get more pain they try for sit down that side with comfortable. If they sit down like na chair, no be saying a hard chair or in a bold chair or whatever, even a sit down on top cushion where is soft, and not sit down there for long. Where sit down after 30 maybe tin up, you change position, you walk about, then they help for reduce the pain and the discomfort. Then one the way they like for cycle, you know, you get people who are very keen cycling people, then they cycle for long distance, either for go walk or for go some side. You get for you not say no cycle, but you get for like reduce. If you cycle for some time, you get for take a break. Because usa you the sidom, now usa really the pain there and you the press pan the gland, usa ide, you know, the prostate gland as well, they press sidom pana. So if you're able to avoid that, fine. If you're not able, but if you're not able, because of your job or other condition, you reduce the level of cycling where they do. And then you get exercise. Try for exercise a lot. That will help. You know, exercise, they help your mental health because they help for send blood supply in your brain. You know, it helping for produce the happy hormones again when they call endorphin. So it help you exercise very good for anybody in physical health. And you find way for relax. You know, if you become stressed, depressed, especially during this COVID period, you know, people are very much depressed. So many mental health problems that happen during this COVID. Try for find way for relax. You get relaxation therapies. You know, either take deep breath in and out, or either listen to music. That they can left for would I like music? You can listen to them and different type of music that you can call, you know, like an app where you can download on your phone self, what they call white noise. Sometimes some people don't get sleep problem, it help them. And you can take warm bath, you know, before you go sleep, you know. And so basically this is not the advice we they give to people them. I hope say people are able for understand the explanation so far. As we can say in our slogan, well body, better pass Gentri. And this very much important, well body, better pass Gentri, where they ask people not hide your conditions, meet your doctor, speak to your doctor, not suffer in silence. And so for this, we tell you all thank you for listening to the program today. I hope say this be useful to everybody. Would I get any question? Can ask question now. Thank you.
Thank you very, very much, Dr. Turay. If I'm the past couple of weeks, it make I don't be very, very sensitive to me seeds. You know, every 5 minutes now, I don't get excuse for touch up. Make sure say all right. But I decided to laugh now.
No, good excuse, man. A good excuse. No doubt about it. A very good excuse.
Thank you very much, Dr. Turay. I'm glad the way you highlight about boosting, because we don't get a couple of questions already on my phone. People they ask me not to disable boosting. Now, as you know, it will come to that side. I hope say me family I don't understand a little bit more than we to know prior to we join the show as to what they cause them tear and you know how for treat them and stuff. One of the questions I want to ask, if anybody want to ask question, do you have a family the tool gets some side where you can issue an. If I see you hand it up, then I will call your name and ask you for let you ask question. Now, if you're not sabi use them, just issue your normal physically. Then I will come to you if I see you. It will be first come, first serve. Me, you know, not all man I'll be able to see immediately, okay? So if I don't see you quick, they are big noticing I ignore, they ignore you, okay? One of the questions I want to ask, so this sickness now only old people are not more educated?
No, it happen from every age. All age they happen. But it must come on people between, according to studies, because they try to get evidence-based medicine, between 30 to 50 years of age. And now because, you know, sexually transmitted infection is very common, we see this, they happen with more younger people. The more they get about because due to the infection through, you know, water infection.
Okay. Thank you very much, sir. Mr. Koloko, I see you don't go off. Yes, you see, go ahead, man.
Yeah, thank you, Dr. Kamara, for Dr. Turay. Sorry, I called the doctor them. Thank you, Dr. Turay, for this information we don't give for the man them, but for the woman them herself as well, because anybody who gets a relationship, we self now for the lookout for your partner as well. Now, you talk about sexually transmitted disease or infection. I just want, if you're able for sort of tell me which are the different one or two different sexually transmitted disease them so that let people understand no more. When you say STI, some people are not going to understand what it means. So at least let them know waiting are the STIs and where they go look out for.
Okay, so the most common one are chlamydia and gonorrhea. I mean, most people know chlamydia, gonorrhea, and are the most common sexually transmitted infections. Them chlamydia, it can be treated with a simple antibiotic. Gonorrhea, because of the number of times the people that only get a very difficult to treat because resistant to most of the antibiotics that we need. So which is why I would emphasize, say, if you get the infections and you find you see your doctor. Because if it's chlamydia, yeah, you can maybe give you doxycycline, it might help after 2 weeks or so. But and gonorrhea, sometimes you need injection added to them. Because over the years, it only becomes so much resistant to antibiotics then. And the one when just water infection, things like E. coli, different and bug, where they affect the bladder. It can be just water infection, but mainly for STI, chlamydia, gonorrhea, the most common one then.
Okay, thank you.
And sorry again, the symptoms that people need to get, you see where they get wet, they get discharge, some kind of yellow discharge or offensive discharge, now your front passage, that they show you say this one a STI or STD you don't get. And not just chlamydia, gonorrhea, things like HIV, hepatitis, all you get and through that. So which is why for treat STD, maybe we'll get a time where we'll talk about them. It get for be you get for guna gum clinic, the sexually transmitted clinic, because the HIV, even you get them, then we'll go do you test and say negative, no means say you not get them. Then get for repeat them, maybe sometimes 4 weeks or so, although then get advanced instrument investigative tools that they use now. So treatment you get for day up to 3 months sometimes, because you get for come back, they come for check you if you don't clear. So I just want to let people know say it's very serious. And dandy. Yep.
Yeah.
Thank you very much.
Now just finish quick. Just one for just more for let the people within a free tongue, within a salon, let them get the understanding that we get all the gum clinic and all the things and they at least where you don't explain so people are going to understand where if they experience any of that, any pain, whether they pass water or whether they discharge or the discharging color different and all that stuff, then they let them know for saying something wrong with them, not to juju, not to anything, something wrong with them. If they're able to go to doctor, let them go to doctor. If they're able to talk to somebody, let them talk to somebody.
Thank you, man. Yeah, and to that, not to nurse. I know say the nurse is not good, but certain illness then day you need for go to doctor. Because I understand that they talk to people in a tongue, boku. Small tiap no more. The nurse where they next door, where they all be don't go school, where they all go up and they go to. Yes, it's cheaper, but how much money you go put per year life? That money we save. If you know they again, that's somebody else get for it. Okay, so yeah, they say if you afford them, try for go hospital where you know well. Uncle Doc, they come to you in a bit. Yes, Boss Carlos. I didn't hear you.
Yeah, because I don't meet me.
Yeah.
I think no more Dr. Turay, because what you can like who saw come out, I mean, both in a very common thing, I would say. Most of the people that I grew up with when I was a child, they all get majority then get bozy. And it started off at the age of maybe childhood, something like that. So I don't know, because your reports talk say the more predominant, kind of chance for get bozy or whatever is between the age 35 and above or something like that. But I don't think in a situation where then the born begin today, they say, pantimini, we call them carrots, basically. Now that's tell we. So I don't know if the study actually don't consider that, or how come begin with the born today, they say gets, bozy, something like that. Not actually come out visible, but I be there around, adults, them come there where they talk, say, oh, you get this, so they begin to take all kind of native medication, for trying men. So I just want to throw a light on that, please.
Okay, so when I say a common, that no means they happen to begin.
Right.
It happen to them, but it's more common at a particular age.
Okay.
Because at a certain age, the pressure inside your tummy went down in the gym, then they walk, then they this, that, it increased that pressure, and the balls they form when they picking the inside my mind belly, it form from in back. From the back they come out, it travel na the belly, it travel go through the groin, and it can down for can hang down na the balls. So that passage there, it creates an opening. So that passage they supposed for lock.
Right.
Most people them, they need a lock. Picking them bond, they need a lock quickly. So when them bond them, it is say imposing they swell up with water. So the way put the picking lid on, it is say it reduce. But way after during the course of the day with the mommy, then they change it. They say, oh, this supposed to not be go. This morning I will be big. Now because the water don't drain candy. Okay, so in the UK, when them born picking, now part of the thing they call the childhood checks. Every pediatrician they do before then discharge the picking hospital. Then they check in balls, now part of her, then they look in eye, then they look in balls, the two balls and for so say the testicle they. If they not feel anyone pan them, then they send the picking after some time and they send them for letting go to scan and for suicide testicle day. If not 2 days when they not see, then they can be immediate emergency. They will try for doing quickly. So then can they after 2 years, they see the blockage don't close. You see, so then they do then checks it. So it happen, yes, with Bikini, and it common with black people, like common with we community, because that passage not clear. So with elderly somebody, where some 10 that passage they don't close. But then it do things them with a heavy duty work them, it increase that pressure, it get a hernia. So that hernia they open when the medical, what they mean by hernia is a defect, an opening or passage. So that opening they part of the gut or part of other things, and they pass through. And when they pass through, it can't travel now through the groin, they go inside the balls, it can't do. So they can be able for push it come. So they can need able push, and the way you need able for push come. Now it can cause emergency, and we need immediate operation. You see, so the only water we then call a hydrocele, and the get on a hernia when a part of the gut they go through. So it happen with Pekin, it happen with elderly, but sometimes common with elderly, and if you happen with Pekin, sometimes it common in Wεll settings.
Right. Okay. Right. Case number 2 then, that prompts me for all I ask, how effective or how active somebody will get Bɔdi, sexually, how active the medical don't find out.
Honestly, it will be active just like any other person.
Yeah, because what can happen? Sorry for continuing.
Go on.
Wait. I want to ask, who's kind of active you mean?
Yeah. No, I may come. Like me going round when we kids, all my they say, oh, you get Bɔdi, that means say no active, So obviously that can cause, people at the village, they don't know the effectiveness of somebody who get Bɔdi in terms of also, and even go to the extent say, oh, not in Bikini, not in Bona, because then come, like a stigma attached to it, based on them things they.
Okay. So,
yes.
So in a way, for within a sex or for let be active in that perspective, now your man side, now blood supply, now they go there. Okay, you forget blood supply and for let you get the thing up and for let meet with somebody, right? So if you get Bɔdi, mean say blood supply need to go there. So it can still be active, it can still be do what they do. The other thing, the only thing where they affect the person in most cases, because you get Bɔdi, because that stigma don't they around, it affects it mentally, and the connection for let somebody meet with somebody, it come from the brain really. For let you get that excitement safe, not from down here, not from up. So if you don't get that depression, they don't all man they talk say me get Bɔdi, I know this, I know that. They need even tin up safe. Even person will not get Bɔdi, you just depressed from work, you just get problem na your home, family home. They even tin up. Yeah. So the thing for let down the tin up, it need for come from your brain, not from down.
Thank you.
Indeed.
That's very important.
Carlos.
Indeed.
Uncle Doc.
Carlos, don't call shit on
But
this.
not so for man no more for woman self na the same thing.
No,
Right?
they can't. They can't.
Yeah. For woman self na the same thing, not for man no more.
Sorry. Yes, Mr. Ibrahim.
Carlos, if they don't consider they say the way they say it not there, that person don't like by maybe. Because obviously the way Dr. Turay just explained, say, everything about body, everything, the function, everything, mentally, when you're strong, you become more effective in what you do.
Yeah.
The very important thing that I want to focus on, just the way Dr. Turay clearly explained that session. Now we just agree a few minutes ago. We are very thank you. May obviously very informative. It covered a lot of things there. And me, unfortunately, I don't call me picking for join because obviously I say the STDC, obviously they come to the stage where it don't become like a man now, not just a year in between. So it'd be very good for a joining session. But unfortunately, I'm able to get out for join today. But perhaps the session we recorded, I will send them to the watcher after. Now very good thing for that we all get for learn. Lord no say then day, not to like what you all say, not to juju business,
No.
I know say one time somebody will ask you, what you make with try to promote a Western system? Well, body not to Western system.
No.
Well, body not to Western system. I mean, as something we need for now, say not to Western system. Now the most powerful thing when a gift we God give we will need for look after. If we don't get people like Dr. Turay, Dr. Kamara, Dr. Ziza, who they all don't get, the chance to go get for know how the whole body the function, they come for educate we. I mean, law embrace something and they will try to push them forward. Then to platform perhaps tomorrow, we will sit back and say, okay, this is what you self don't learn and what you self don't pass on to your own people now. You understand? So a very good thing. I hope it's after time, we'll do a session where we'll test and I will begin this. We'll not do it again, other people that take the baton, and run with time. So
I see face on YouTube, so they ever accommodate. So nobody will forget you.
Yes, TJ, carry on.
Magic man.
Yeah, Dr. Kamar, I'll give Dr. Turay a little bit of break. Doc?
Yeah.
Perfect. I get a question. This disease here can get to a stage where it will need organ transplant.
Wait, you mean whose disease the way they talk about?
I'm talking about the prostate, basically. In any case, they can get to a stage where somebody will need organ transplant.
You mean sexually transmitted diseases or what?
No, I'm talking about the prostate, basically.
Prostatitis.
No,
prostatitis as it is, as just like how Dr. Cam, that gland, that thing with under the bladder, if it gets inflamed, that no means they get for transplant. I mean, no matter how it gets inflamed, as it is, what you go, the worst thing we go cause sepsis with abnormal reaction to infection in the body, we can cause the organ then for begin fail, like the kidney, the heart, the liver, and then of course the person can then die. But transplantation not coming to that, because what you do as the team begin no more. This I want you everyone just help for a doc for clarify. You see, you get two sides for look this thing as a two-pronged approach. One, the woman that I see mommy they talk about that. Now the woman that with the sexually transmitted diseases, then STD with the report. Then you quick for able for catch that thing there. They able for notice, because waiting do the tube inside the water they pass, the urine they pass, they own very straight and short. We demand that now. We obviously, because we get that long one, we get 3 side we can block. Now we can notice we get this infection quick one. The only problem is we need to go see doctor quick, because for one, with the shame. And only when the thing don't become chronic, because as you say, some man go begin get this discharge, some man will get problem, the pain for pass water, you will begin go frequently, begin go 4, 5, 6 them, wake na net. Where if they see them, they struggle, they ask them and say, nobody fine and all that. That is where the problem lies. Now, the difficulty we get now is if this man, they pass this thing to this woman, the woman no go no quick, because then they get symptoms because they're urine straight. And so now you get a problem. If this woman urine don't begin go up to the tube, them go begin block the tube, them he can't know anything until he gets to the point where the tube we talked about 2 weeks ago, where you want for take Bεttεh, you know for take Bεttεh. Then they find out now say that chlamydia and I don't cause up. You see? Things like gonorrhea, easy because waiting to the man go begin feel am. But that man they supposed for begin seek attention, begin go to hospital, not to them corner part to power boo for go begin get them boomer, then leaf this and that. No, that's out. Yeah. If you begin see the symptoms clearly, that for go, that's the thing with it. Now the important thing that the other thing we can talk about is that thing where we get. I mean, in fact, I'm talk, but I just know say call him Bobo for can listen. Because all this day with the second that the woman they're involved in this thing. But that's what they call human papilloma virus, that HPV, it can cause cervical cancer when we get picking them. Because of that, they don't find out in a virus they cause them. And most of the time the virus they come up from the boy picking them. Now from where this poor lady die of that cervical cancer, it actually highlights that in the awareness day. Say all the 14 to 15-year-old girl picking them, they're supposed to get this vaccine. This maclate for stop that in there. Then not only stop that, then go to the bobo them as well. For make them know say the bobo themselves, if they stop them for passing to the girl picking them, then this thing will calm down. And indeed, this thing don't calm down by 25% from where there is the awareness. That's just go for tell you, for show you how awareness, how sensitization go work. But in terms of coming back to your question, in terms of this prostate problem, needing any organ transplant is not likely. Because it don't give you information long before the kidney they pack up. Because when you get a blockage, now one of the main things that we can make boy picking go to hospital. Because if you not pass water, that pain day is not small. So if they go financing that the prostate not big, then go give you the medication where you need, the tablet that we need, the antibiotics, and then monitor and make sure so you're fine. If now other activity because I'm saying, for example, sexually transmitted illness or disease, they're going for investigate you and treat them accordingly. So you don't get that. As I said, you don't know exactly how it is. But I will talk no more. Let us not day in silence with the suffer. There are ways. There are places they will go seek help. Not to go around that corner. Please. By telling the Mara, it will cause problems. So Pabu now no for now. Please. Thank you so much.
Thank you very much, Uncle Doc. You just touched on the next question I want to ask actually about the woman inside, but you don't touch that side already. What I want to ask as well is if man they pass water frequently, obviously apart from the obvious way, maybe some of we if we drink too much beer, you go to the toilet frequently. But if over a couple of days or maybe weeks and stuff, you pass water frequently, would that be a sign say something not right?
Yeah, you can say that. You see, you can look at it from the point of view, just like how you talk and say, this person they drink beer, and beer as they say, alcohol gets diuretic effect where they make person pass water. So if you go, the more you drink, the more you pass. Simple as that. You understand? That's not one thing. However, you got to take this thing into consideration. Say, who stand why they pass this water? If I know they drink, yes, I pass this water boku, but at the same time, I feel thirsty. You need them for begin think about diabetes.
Diabetes, yeah.
So this is the thing. So everything linked up. If not, you're an older person, that you don't do in your 60s or even 50s, maybe 70s. You don't find out, say, this belly don't begin big by you. That you begin wake 4 times, 5 times na net. They feel for go past water. Yet we go for go past water, you go team up this and then 5-10 minutes. You understand? You begin get drop. In fact, they will begin laughing, say, why did it lift the toilet seat up? Because all the toilet seat don't soak with this wee. You understand? Sometimes they at the carpet or sometimes at the floor where the smell and go begin attract people. They think they not to the need for shameful. You can't shame for that because that's the way they happen. You understand? So tend to the best of we. And I make way happen, you need for seek help. Now, if that happen, then you begin for think, I'm going, I've been the past water, fine, but nowadays I go for begin penny, I go for begin push for make this thing come out. And when they come out, so you need to come out well, until I'll get 1-2 drops or maybe 10-15 drops, and that's it. Then I go back for go down for sleep, then I begin feel back for go. So you go work 4 times, 5 times, 6 times na net. That all na sign for say the prostate they get big. You understand? Also until the prostate don't get infected. So all that thing have to lead you to one thing. Go, or if you go somewhere you go past the water, you see blood. Because some man know they look the piece of. They see whether he concentrated in dark or light. Because if you drink, like I talk so, if you drink too much beer, the urine where you go past a light, like say you put lamp and water. Now you can go test that water until you go be negative, but not false negative because what you do it too dilute. But then you look at the other side, you concentrate. If you dip and fast, you don't drink water all day, then you go cut fast. The first water where you go past, you go say, I'm very concentrated in dark. That's just to show you the poison way the urine they pull in the body. You know, so if that poison they got an body, they is thinking about how the body they get poison. That's not the other thing. So your question we ask very relevant and very good. If person they drink too much water and he pass equally too much water, that might be okay. But if you know the drink, then you they pass water too frequently, you get for begin to say, are they feel thirsty or not? Obviously, if you're in a hot climate, yeah, this is how that people can ignore. If you're in a hot climate, you go drink more water. And I make them say in winter, yeah, they expect you to drink up to 6 glasses water. In summer, so until up to 8 or more. Because, you know, I think Bokuma not even know, say the sweat with the pool, that sweat with the sweat.
Yeah.
Now urine down this, so na piece.
Yeah.
But now the dilute form of them.
Yeah.
Now I make some how we get kidney problem, you get specific smell where you pass near you, they know say this person get kidney problem. All that thing and then nothing that people for know, just let we understand one another. You know, but it's good for let we will tell people and then can't hear. So if they drink more, and you know say this not to me normal way, please get that checked out.
Thank you very much, Uncle Doc. So Dr. Turay, they come back to you. Now, while I discussed this topic with some few friends of mine, so one question, well, it come up as a joke in a way, but as until I don't look online, I don't see them day too. Say if you abstain from mama papa business, you know, for a long time, is there a case of say you could develop prostatitis? You know, and then say the bag will full up. Some people don't believe in that. What do you think? Or you know, what are the medical explanation for that, sir?
No, I don't think there's any tangible explanation. They say if you get mama and papa business, they develop prostatitis. Prostatitis now inflamed or infection. Okay? If you not get mama and papa business, how you go get this infection? Okay? So they can get the infection through maybe through your wee. You know, you get through that side there, and so thinking they don't know the cause. No, so I don't really think any tangible explanation will say you will get prostatitis or prostate problem because they do mama and papa business. So I'm thinking when they do mama and papa business, the sperm they store, so they absorb na the body and everything. So that don't mean say you will develop problem with your prostate.
Okay.
So,
because Carlos, I don't give excuse now. So now you can abstain now.
I just people let you talk that. Now you make the answer.
Like they say small thing to Carlos. Carlos, you talk about this thing.
Yeah, Mr. Falani, come to you next, sir.
Yes.
Yeah, go on, Mr. Sise.
Yeah.
Dr. Turay.
Yes, go on, Doc.
Yeah, you talk about this thing.
Yes, Uncle Doc, go on.
Talk about Mr. Carlos asked about this question where he say baby they born today, they say you get this peg there because now they don't know the name that peg there. That's right.
Exactly.
Okay. Now that the problem is, as Doc talk no more, if this thing not close, I don't see mama bring Pikin to me at the age of 1 month. He say, hey, look the Pikin, but look how this thing swell. How do you understand? He don't deal with this Pikin all this time. He not notice and one day. Today, they watch the Pikin. He notice say, oh, hang on, what's this swelling come up? Begin afraid. You understand? You examine the Pikin. You not get one pain panda because what you do, he born with that defect. He born with that abnormal opening there. Now then kind of day, now he go there for years. They not touch him. That's not the baby side. You understand? We're born with that defect there. But then the adult or the older people, and where they get that day, now one day we be done deep on that heavy duty work. You understand? People away now athletes them like them. I mean, I know I'm calling name, but one per Man United legend them. They begin for operate panel, for them. Both decided to operate panel because of that routine. They get for do then sit up, then press up, then lifting and things like that. You understand? As they grow older, their muscle then do what we all get. Now makes something then there's a man at the age of 20, he gets that what you call that in that 6-pack. By the time he go now to the age of 60, you sign now 1 pack he get, So
Uncle Doc, I mean a pick on now.
I say nothing more. so that pressure they make us that weakness been done day. Then TI begin go through. You understand? The gut begin go through small, begin make this thing big until it actually, can bust through the bag where all the blockers. And that's when sometimes they begin feel the issue. So if it cause more pain, then go try for block that in this. Sometimes they need to put that wire mesh panel. We go stop up, but that's it. So you just need to know how they TI the form. it can day in our families as well. So Peking can get them, so then grandpa be don't get them, and then the Peking inherit that weakness, they get them. So, you know.
I'll be other thing I will ask about Gentri. Mr. Fala, I come to you 1 minute. I just want to ask for people that they play sport. You know, like maybe talk about sports just now. You know, so then we can get a case where they play football and can put on the blind side. You know, don't get that. If they blast and is there any, Mr. Sise, I'm a serious question because they will not pack up on me a couple times. So I know what they talk about. It's painful. Now, is there any chance of make a serious no?
Okay, sorry.
We will suffer from stuff like this?
No, complication can there because if that thing they hit the bolocos, it can cause them for bleed because they get blood vessel pattern. You understand? Now they can call hematoma. You understand? The thing can blue and black so. You understand? It swell, big one. Now they can cause a lot of problem. It can cause pain to the extent some man they can't hospital straight away. Then go for begin watch for see that thing. They make sure say you know become an abscess or become necrotic. You know that cause problem. But it's not way go absorb. Like how you bruise your leg. You understand? The thing bleed. That's how you go get yourself back into the body and then get better. But they need for monitor them. So they need for keep an eye on them. They cause more problems. It's as simple as that. Okay. But go cause anything like prostatitis.
We're on the safe side. We're on the safe side. Boss Carlos, as you say, yeah, Mr. Fala, now you next, sir. See, we got the count to you, please. Mr. Fala, unmute yourself, please, sir.
Yeah, good evening. My name is Ahmed Fala.
Welcome, sir.
Hello?
Yes, sir.
Hello.
Yeah, thank you very much, everybody, and thank you all the medical experts there. And it's a very great opportunity, first of all, for Ladia. And I don't learn more again. I learn more and more about the prostate and prostatitis, and I don't see the different system. Thank you very much. What I want to say is this thing, I don't hear about actually the symptom na salon wouldn't you say then they back by somebody or a get Bɔdi. And we'll get different interpretation about that. It depends on which region where you come out. And I think say this they kill beaucoup people in na salon because it's like a taboo where you get up. I don't know relative them we don't die. Them prefer for divorce with their wife them before the woman will know or anybody know. Because it thinks an abomination, not a big problem. How we go able to intensify this awareness now with salon community, because this one is even worse than COVID, because if it come on at the Black community, and I should say beaucoup, millions of people then would die in silence. And it just, not today it begin, it don't day since Adam was a boy. And still, there is no other way, even up till now in a salon. People in the die, but people in the die in the corner. So I wanna go help we follow we make the awareness more in a salon, let people that understand say Bagba are part of these things, and also this Bɔdi are part of this prostate. I don't know how I will explain that more in the medical terms for free. Set me free. Thank you.
Thank you very much, Mr. Fala. First of all, I will say something short and I'll pass you on to Dr. Turay. Basically, this will I've been advocate for in the start and also on the past couple of shows then for say, if anybody gets and they'll get influence, if you get influence or you get somebody within media and salon, we go interested on the show, we'll not charge anybody for them. We don't give it time already, we give resource. Always they need for just give a platform, like an hour for air the show for with people and get that's not one part the main ways then we will be able to educate people and for them to understand say somebody where they happen. A natural thing a way can happen to anybody, and let them begin to understand the medical reasons why they happen and how they be able, if I change their lifestyle for make sure so they're able to manage them or maybe go see medical attention and stuff like that. But the main thing, wait till you ask for the main way for let we be able to get to people for let we get access to media and salon. But Dr. Turay, from a medical perspective, like you're demanding Mr. Fala question, what do you get for saying that?
So I think I'm very much happy for this question where this thing where you bring up, because we people then really they suffer in silence. We all from salon we know how people they take them as taboo, and always get ego. Every man get ego. You want for maintain that ego, and for anything they make people and think say. That man side, no wait them call it lightly. you know, and they take a likely at all. This is some man who prefer, you know, a sofa before, you know, then they become waiting. But in most cases, now understand or not understand, say most of the things not to the money problem, not to your fault. Other conditions and they we can lead to that. Like how do I explain clearly that these balls, you know, they talk, the ball course or the balls bag in condition the way they happen with her, a different. The prostate in condition a different, although they near, and even the conditions so people in the get where you can see some man in the cough no more wet pass come up as a panam. Then call her incontinent. Then they come up with woman, the man themselves can get a urine incontinent. Then they have a problem with the bladder. And again, the back pass is just like the pull they pass. Instead they close day. So anything will happen around because then they near, you know, you go get symptoms and way interconnect, interrelated. So which is why I'm glad you bring this to us. Say if people and they listen to them program there, where we already take payment for we they do we they make all we effort for them, we make people understand this thing here. Say this not to thing when are you problem, no suffer in silence, see you doctor. Not look pan the money no more, like how JT talk, not look pan the money say if I go meet that doctor, I will charge me X, Y, and Z. You will body better pass that money where they go keep. Okay, so it meets the right appropriate professional. It investigate you properly. It take history. That means it ask you question them. Be open to them, not hide thing from them. Explain to them. It able for lead you and know which part of the area affected. It can be in the ball side where we don't talk in detail, where it can be from where you born or you inherit them, or it can be at the prostate side, where again we don't talk about the different conditions really affect the prostate, or it can be at the bladder side. So it can able for distinguish them and you know how they help you. So Mr. Fuller, the other side we use safe cable help we now for send this across to who that you know this program there in YouTube, who that you know, invite them to this session. Send the recording to them, let them listen, let them say yes, this condition that we not hide. I mean, we they in Naya, we they treat white people. And I'm telling you, the white people and the way they care about their health, like na in finger or weakler or na in finger na begin change color small. The next minute, they come meet you, they want to know the details of them. And then they accept them, and then say the research, they go put say this na somebody don't back by me. You not get down this safe. They want to get a medical explanation for anything. So, but we young people, even the people where they in Europe now, I'm telling you, they know they go see the doctor there. Something they happen, they keep by the eye, something a simple thing where the doctor can able to deal with in an easy way. But you need to go meet her, you need to go meet her, you need to go talk about her. You see, so it cut across maybe because maybe just now we own culture, but we need for change than they. We need for be open. So this program, Yusuf, can help for advertising to people. You can help for make people send the video to people in YouTube, link to people, let them go join, let them go understand. And like how JT don't say, if we dey for let the air out na salon, let people listen, it go fine. I think that's and I'll stop so far.
Thank you very much, Dr. Turay. I get one question where somebody be asked. This prostatitis is common amongst Black people, and why?
It common among both white and Black. They both the one way most common, the cancer, the prostate cancer, more common with Black people, and even the enlarged BPH more common with Black people. Okay, again, people in the associate and say because Black people, the level of testosterone, none of the hormone or the chemical where they make the prostate and the sperm a high in Black people. So the Black people the tendency for like get prostate problem more than white people. But it cuts across all the infection or the inflammation can happen to any group of people. Yeah.
Yes, Isiruge.
Yeah. Well, we start one day back now. So a lot of times that day, Dr. Sise, we don't talk Dr. Kamara don't talk we all don't talk for say we Black people for like we go to doctor, not trouble. it go left and say, because we afraid for die. We afraid for let them not go tell Louis until we go create problem. We afraid for let them go tell Louis until we go say, you know, go for go walk. You understand? So that one day, I think now one of the reasons them, where now towards the end, where the end don't come, now that's it now, when you go begin to think, some people then begin to think, oh, now do them do me and all that stuff then they. But at the very beginning, where things then they happen, and that's 10 day for go to for go seek help. We're lucky within this part of the world. What about the other where they na Africa, na Salon, we not get this opportunity. You know, for me, when we start this thing, now the more me they think about all the time, how for sensitize them, let them self-understand what thing they go on. You know, because like what I want to talk about back now about this stress, you know, like the buzzing or you know where the hernia they take place. If we think about two people in a free tongue upline, then they lift so many heavy things them, you know. Then they lift so many things them. They never ever think for say that one day they connect with waiting the happen for like them get the buzzing or waiting the happen. So we lucky na so for like we get all the opportunity for take them. Yanda as anything like that they happen, now different thing than they begin think, maybe they mask something or they see something or they drop something for them, you know. So it will be good for like they're able, if again with the ask for like they're able for year this year so out, then maybe after COVID, maybe we will get the opportunity for like we self go there, go give a bit of we own time. Me, I'm ready for that one day anytime, as long as I get the opportunity for like we go sensitize to people then. So that we self go able for.
I mean, don't get free tickets for Go Salon. So thank you very much, man. I get one question that will come to you, Mr. Sylvester. I don't know if you see this, Dr. Turay. A question say if person get catheter fitted, they can able make mama papa business.
Oh no, but let's just take it this way. You get the catheter. Some catheter are some way introduced from outside come. I mean, just look at it logically. How you go able for get mama and papa business with that? If the catheter the inside, you get different type of catheters. Yeah. Okay, yeah. You get catheters the way you can introduce for yourself for just empty the bladder that you pull up. So if somebody concerned about catheters because of catheter, no go get mama and papa business. Talk to your doctor. No hide. Oh, they keep saying it. Talk to your doctor. Catheter they different stages. Different type of catheter. You get the one where the doctor will say, okay, well, you want for do mama and papa business. You can fix this one for the tail we need to do them. Where one for do you pull them. And you can put another one. So you give different type catheters the way they give, where you go to pull out. So you go still they get, you do your mama and papa business with no problem. And also as long as you get blood flow, they go down yonder and your brain prepare. You're able for continue doing mama and papa business with no problem.
There you go. That's the answer. The mind and make sure say blood flow. They go under and talk to your doctor. Mr. Sylvester, sir, I'll go ahead, sir. Yes, sir. Welcome.
Yes. Hello.
Yes, sir. Hello.
Yes. Okay. I'm very grateful for joining this program. A friend just sent me the link. And I just say, I give them a try, and I find out say very much useful and meaningful. And I thank you very much for organizing such a great thing.
Thank you.
This it prompts my mind to a very sad thing that happened to me last year. My daddy been sick. I go see him, and I go find out say na prostatitis. Now been there with him, and we come up from upline. The hospital saying, "No, we able to do much." Then refer we in a corner, and when we go to a corner, then tell we say now one only neurologist we get at the country. It's very sad. And when we go,
oh, we don't lost Mr. Sylvester.
Yeah, sorry about that.
Right,
now in private hospital, and we go now in private hospital, the cost. Okay, thank God I'm able to afford for that. But like other speakers, they don't say. A lot of people then they would suffer with this, but again the hospitals they're not there up to scratch for even able to help them patients there. Just like I tell you about my own daddy, what happened. So when we talk about promoting the program, I just very much don't know if na excitement or just want to say, well, Papa God, how this thing able to reach Sierra Leone as quick as possible. But I think say we all, with a concerted effort, all of us, we'll see how we're able to up this from where we're able to help. But the situation is really, really bad back home. For we, like Dr. Sten say, we all get able, if actually we get the courage for go to the hospital with doctor, then we GP them, we will get treated. Like I would say, most of the time we think about, we think about for tell we sad information about the diagnosis, we'll go put we in a situation where we go find ourselves like always depressed, and maybe that will go to your door. And so we always afraid for go to see we GP them. Well, with this, yes, it will give you the encouragement from what we see we GP them, but do as Sierra Leoneans, the world they will feel say we life much more better. How we were able to up this program and how we were able to see for make people and be able to get the information and also get the facility. But it's sad, I tell you, we pay, we hire a vehicle from upline for country to for country, only one doctor, they say a urologist. And you get sometimes if you don't get the sababu, then they give you 2 days appointment. Imagine you come upline, you don't even get site for lodge in a free town. So this is a very, very challenging issue, this prostatitis. So please, if anyone they will get the opportunity, or all as a country, we able to gather and see how we go promote. If just one thing like this disease will take as a pilot for see how we will reach out to our communities back home. I thank you very much for the thoughts, and I thank you all for the contributions they make for enlightening we, and also for what we think about we home. No, thank you.
Thank you very much, sir.
Thank you.
Yeah, the points that we bring on us, valid points that we don't discuss on previous shows, and for say we and I will continue for do the very best we can for all reach people, and not just with the information, but also for try for see if there's a way we can able to support doctors back home. But this night it will need a concerted effort from everybody. We and I we open and ready, for help or collaborate with anybody as long as it will bring, benefits to people. So if anybody gets the avenue, you get the influence or whatever, please get in touch. Whatever we can do for help people, and we go do. As soon as you can see, it takes a lot of effort from we all for letting share the country. Before we do it every week, now we do it on fortnight. But even at that, it takes a lot because we all work full-time jobs and we work long hours, but we find that time, for a lot of dedicated to people. It takes a lot of dedication. SCC will get. I will count to Mr. Ibrahim. Then we'll go round up because we don't run out of time. Dear my family. So CC will get you. Then I'll go to Mr. CC. Then we'll go round up, please. Yes, CC will get.
Okay. Yeah, I just want to say thank you for all man way attend first of all, and for the positive talk the way for every time we'll get the session when you people in the come and everybody safe. Now the same. Like we all get the same aim. We all get the same. How they call them for like we go help salon, we go help people them. So I pray say one day we'll be lucky for like we get that person in the other organization. They'll go say yes, we will take on our own. So thank you, Dr. Turay, as well for the information. Me the only thing like I say, all say what they talk. We are lucky in that we've got the opportunity. Then the way they under again, imagine that man where they experience himself. One day grab no more, they feel like it get difficulty, maybe it get difficulty with for pass urine and all that stuff. Then how we go to feel for in family, how people then go how people then go to think about them and all that stuff. So we just get for support people them as much as possible, and let we just continue with this, Dr. Turay and everybody safe, because everybody the contribution we all man they give it help for let people understand more of waiting to go on and how people then go understand for say whatever they happen to them na them body, na their life, get nothing to do with anybody, just how the body system they work. Thank you
very much, Cecilia. Mr. Sila, I will make you the last person there. We don't run out of time. So I will say, Mr. Sila, Mr. Sila, I come to you. Mr. David Sila?
Yeah.
Yes, I go ahead, sir.
Just want to say good evening to everybody, and I really, really feel fortunate for able to today. Now I'm send the link to me. I just want to touch on the mass education back home with regards to nothing way possible, because I can give one example. If we look back let's not even go too far. Let we say like 15 years ago, you get the rate of them funky business where they talk about they're so boku. But when you look these days, it don't cut down simply because people are not aware of high blood pressure. First time person for don't die, oh, then this is not funky. But now because the education they go out there, that mass education they go out there, so people are not become aware. Anybody now say, hey, then they get pressure, then they get pressure. So unlike first away person, they for don't die out of them massive stroke or massive heart attack, where they link to funky, these are not doing don't do them. Now I grab just new. We find out say the number of fungi, whether they call fungi, it don't go down drastically. So equally so with regards to them other sick there, we can able educate people them. And like what my sister been say, if this COVID done, me na one person we go volunteer. Me na nurse by profession, me carry a nurse, and I currently they manage one nursing home. So I'm always willing whenever that opportunity they come, or make we go to people them, talk to them, because you go find out, say they go listen to we more where they come on here.
Yes.
And where they talk the language back, not the past way which man they go talk as the interpret for in a village.
Yeah.
I go if not Timni land, I able talk Timni.
Yeah.
To me people them, if me not limba able talk limba, and me not them picking. So that education will go far, and that's what I want to say. Thank you very much.
Thank you very much, sir. Dr. Mr. Sise, I'll come to you, then I'll go to Uncle Doc, then Dr. Turay, then we'll go round up for today. There are many people who don't run out of time. So Mr. Sise, make a short for you, please, sir.
Yes, first of all, I want to tell Dr. Turay, thank you very much for the session this afternoon. You know, very informative. You know, I learned a lot myself, even though we're all in the group. As I say, I learned a lot, and I was so obviously sad fact we beginning to join today, but I will send the link to them. Obviously, after all this recording, I will send a link safe watch because I think that we need to be aware of. And I know say Ahmed Fala asked a question: how we will sensitize with people and back home. And I want to just make safe understand. Say, you know, among the team, these are all well-trained professionals, and we get allergists amongst we get, you know, people away Christians. So, you know, that issue of religious, you know, effect, we will make the people understand, say, look, we all not believers them, like Uma. It's not get anything to do with anything like this. This is something way that we body, our body mechanism they we will educate people, you know, for we change that part, that time. So I'm saying that one of the biggest challenge that we will be facing will be an issue. But like way I don't read this Dr. Davis just say something where my mind don't come on a long time about this funky business. Obviously I've done the area, even when we let that he die out of heart attack. You know, that's something where we very strong in the family say, oh, the funky, I go to a meeting, that's no drama, and they go die. But you know, after my time now with all the knowledge I don't get, I go go back and say, so you know, to funky, heart attack. Yeah. You know, possibly say heart attack. I say we all susceptible to that because we come from the same family, and like me say, me na high blood pressure patients, and I take medication, you know, religiously, I can't prescribe to me. So perhaps, you know, slowly we'll break Mr. Circle, slowly. And I want to tell you all thank you and all you want to attend, and you people who attend, Mr. Sylvester, thank you very much for his personal story. We tell, you know, slowly, you know, the good say would get people in. And don't forget to take DVCLA in contact at least. And sister say 1 January.
Yeah, again, details already.
Fine.
Lovely.
You know, the only thing I'm going to say to we all, you know, then and slowly we'll get to office and eventually we'll get to people who want to reach to. So I tell you all, thank you very much.
Thank you very much, sir. And Dr. Kama?
Yes, thank you so much. Doc, that was really good. Nice. Thank you so much. We're grateful for the input from everybody. As I say, for me, most important when we do this thing, now we force the talk with Krio, now we present Krio. That's the first, and that will be something where for the rest of humanity that them will always, you know, say to we, say now we force begin that. But as you know no more, this thing for begin develop. But you see, the idea is the way we want now. We within the council as we see the number. We want like how somebody they ask, well, how for this thing well? If probably Einstein being say every 5 mortal man them get a link. So if me don't read this thing like how Brother Sila they talk to say now somebody passed the link to them, that's exactly the way by word of mouth. one person passed to the other, the other passed to the other, and he can't see for himself, equity see, now so the thing will continue. Now, who knows? Somebody go there related to somebody within a free tongue with sometimes get that possibility for day with AYV, SLBC, any of those. You understand? If they were for just listen to what we get for say, just want and no more, like how people in council and listen to what we say, who knows? But we actually begin this program for let we talk to people. So as you talk about awareness, sensitization, mass education, all that things in there go only possible if we get the vehicle, if we get the possibility. And that possibility mainly now from word of mouth. Like how you cancel, you enjoy some man come and share your own personal story. You know, like how Mr. Sylvester come and talk about in Daddy. Look at that, a whole country, way in the Athens of West Africa, get proud, they boast of one great neurologist. They just go for tell you, say, we there, we want for help, but we need that support. We need for people to get this thing, for reach to people and for make them know, say, we self, we proud, say, now yeah, we come out and we willing for do what you will for do. We don't ask for pay. You know, we will begin, I will not ask for pay and we will continue not to ask for pay. We just want to let them give you that possibility, that vehicle, that chance for let we show them what we go for do. Now make anybody where they are, make we scatter the word, make we actually get this thing so popularized, so popular that all man go want for come and join. And you know, other countries they do them, other nationalities they do them. You know, when you talk to the Caribbean and they come in hundreds, we young people them now 20, so 10. If fine for let we know say this thing a good thing. And we think we're good, it's necessary for nourish them and for cherish them. And that's what we go for say. Remember, well body, it better pass Gentri. No matter how much money you get, if you not get well body, believe me, that Gentri they go actually done and the sickness still continue. So dear, let us scatter the word and thank you very much one and all. God bless we all.
Thank you very much, Uncle Doc.
Thank you.
So Dr. Turay, what are the final word for people then?
Okay, so I think we don't say everything now, right? So the final thing to everybody is, well body, better pass Gentri. This not salon program. This now you people learn from Sierra Leone, they talk this thing for help you. We need to take money from you, okay? The condition where they happen to we, not link them every time to black magic, okay? Try to find the medical reason why you unwell. And the organ then are motor mind body, then they close. And the way then they function or the way God make them they function is different. You need to understand them for relating to the symptoms where they get. Maybe if you do that and you do regular checks on yourself, it'll help a lot. And it'll help for clear the problem where they say somebody just for don't die. You know, they know say sometimes they don't get sick where they go on long, where it not even they see doctor about, it is suffer with them, it think, drink other different medicine. Then bangba or I think say or whatever you say, then medicine they take, then get impurities there where we don't know. They might be good, we don't know, but we don't know the concentration. And even the medicine, the way that they make in the European world, when you take them, some of them they affect your kidney. Even ibuprofen can affect your kidney. So when I make way they take and they give the concentration and they say not take and pass this term, we don't take, I'll get for check your kidney. You know, so if you don't take them bang, then they say don't go affect your kidneys, or it don't go lead to other problems like prostate. Now that medicine don't kill you. It will help you in one way, kill you in another way. So in a way, I'm not to say cry down all within people and they do. They might get reason for doing it, but investigate. Let's investigate. We know Salon, the investigative medicine is not as advanced as here. But people in dinner salon, colleagues in dinner salon, where then go listen your story keenly if you give them time, then we examine you thoroughly for lead you gradually to what you want. So not go meet somebody just by the corner because they get injection. Meet the right person. So I think say, and the people again, just like Dr. Kamara don't say, I don't know this program. You get 2-3 people away, you know, every 2 weeks when they do this program, you get the link. You can send them the link. If you know everybody, we can send you a message. So when this program they happen, when they give you the link as well, you give to other people them. Let we as a community develop our own community. Let we know they go build up different other communities, communities. Let all come to one and make something one and big. This is where other African community or other European communities in the past. All man they come, if you don't say this is a saloon group, and then they will make another group, they come together and join. So that it make them big. We don't have all the ideas. We can come and make all the ideas and make Salon a better place. No place is better than home. Rugi don't say we're more happy for go give talk na Salon and help people them. So I will stop so far. Thank you now all for listening, and hopefully we'll see you back in next session. When I give you session, we'll talk about that. Thank you.
Thank you very much.
Thank you very much. Thank you.
You know, all the professionals don't tell on the same thing. We say get for safe for roundup. Do you have get any topic we will not go leg for Yeri? We will not cover it. When I make you know, if we don't cover ourselves, maybe you miss some. You go on YouTube. The other topics and the both. When I still want Yeri, I'm again say maybe I don't go on YouTube. When I like and when I go over my over that topic again, we don't mind. We'll go through. Yeah, the current they say no more well, Bɔdi Bεttεh pass Gentri. I know some people like waiting at alone. Get 14-15 million phone, you know, in thousand, what they call million Leone's phone nine. But we sick if you know, get my go pay doctor 1 million, go say 2 dear. Which you want better, your phone or your health. So Lord, think about that. I'm tempted. I know say you in hospitals. I don't know if you get able to give comment. If you able to comment, show you picture. I go make you give you last comment. If not, I go round up for today and I will tell people and plenty, thank you. We wanna all join we. Let say no more. And everybody don't say you allow pass the message to people them. Let more people enjoy this. Will not take no payment for them. When they get 1 single P for any tool they do, so now free with it one. And with the place we'll continue for do this, Lord continue for benefit to people them. So now thank you. And I get a great weekend. We'll see you now again in 2 weeks. On a good night.
Thank you.
Thank you.
It's a funny thing to think, isn't it?